Thanks very much, George. That was a very polite way of saying I've never had a real job, but you did it very well. Thank you very much. I have been in the political world most of my career, as you say, in various roles. But I hope what I could say to you this morning is my journey has taught me something. It's given me perspectives that I think help this kind of journey towards a global map for healthy longevity. I think I do probably have something to contribute here, because I was the health secretary, if you go back just over a decade ago. And while there is a huge amount you can do from there, you're more in a role of running health services rather than improving people's health. And you actually also feel the limitations of that role. I often described it as being able to see numbers but not names. And when it comes to aging, I think you have to start the other way around. You have to start with names, not numbers. You have to approach things through a social model mentality rather than a medical model mentality if you are to develop a concept of healthy aging. So when this role came along, the first part of England with a degree of health devolution, I did feel it was right for me to kind of step off the path I was on and start a new journey on a new one. And I think what's happening here in Greater Manchester is interesting. I think it does offer something that people in our own country, but further afield, may want to look at. And it's a way of thinking about supporting people through the life course, not just around aging, but in some ways the same principles all the way through, which is person-centered. It starts with the person, as I say, a social model, not the patient-centered medical model. It starts with the place where people live. And it starts about thinking about one approach for public services to sort of support people to live the life that they want to live and be who they want to be. So we do apply those principles through the life course. And just to point to the fact that it would appear to be working, we recently had a study on 5 years of health devolution in Greater Manchester. And this work, commissioned by the Health Foundation, carried out by the University of Melbourne and Manchester, found that we have achieved a faster than expected increase in life expectancy in the city region over the last 5 years in nearly all of our boroughs. And it's been particularly pronounced in our more deprived communities. So something appears to be happening here. If I turn, if you like, to what are the ingredients of the success, I guess I would start by saying, when it comes to aging and sort of rethinking how we support people, it's about adopting an entirely new mentality for the 21st century. I still look around and I still feel we're kind of tinkering at the edges of a 20th century medical model that's based around notions of dependence or separation, of wrapping people up in cotton wool and putting them in a care home somewhere, and that somehow is providing adequate support, or that represents safe aging, or however people would describe it. And some of the innovation is only coming in at the edges. I would say the message from Manchester is you've got to completely turn that on its head, and you've got to start with a much different approach, which is about maximizing contribution rather than starting with a notion of dependence. It's about inclusion rather than separation. And it's about activity, promoting activity rather than rest. The idea that older people want to rest all of the time. I think it is about completely turning things on their head. And just to give people, to bring it to life in terms of what I mean exactly, we've done this with cancer as well. And it's not just, if you like, dementia or broader notions of aging. There were some awards last night. The Health Service Journal, national UK health publication, gave out its awards, and one of our schemes here got recognised, which is called Prehab for Cancer. And Prehab for Cancer is important to me because it kind of embodies what I've just been talking about. It's all about a rigorous physical activity program for cancer patients to prepare them for the journey that lies ahead of them when they go into chemo and everything else. And in some ways, that kind of turned notions of cancer support on its head. And that's why it's being recognized, I think, that, you know, you don't just get people into a kind of mindset of separation and dependence and there's nothing I can do anymore. You actually go the other way and you maximize their activity, their confidence, their sense of purpose and forward thinking. It's about as much the mental benefits that come from that approach as the physical benefits. So that's what we're, I guess, also applying. That kind of thinking is being applied to aging. And what I've asked the team here, I mean, early on, we banned the use of the phrase bed blockers. And I must say, in my 5 years, I don't believe I've heard it used anywhere in Greater Manchester, the idea of older people as a burden on the system. I see it creeping in a bit at the moment when we're having a very hospital-oriented debate about numbers of people stuck in hospital who could be medically discharged. And I think it's important that we don't get back into that kind of narrative about older people. You've got to come at it the other way and start thinking about how do we support everybody to live the life that they want to live. And what I've tried to do here is take the sort of emerging notion of social prescribing, which is the phrase, of course, people will know and be familiar with that phrase. Itself, if you like, a product of the medical model with the use of that word prescribing, and something that still, if you like, lives at the fringes of primary care or community care. I've said to my team here in Greater Manchester, no, let's take that and put it center stage in primary care. The first thing we offer people rather than the afterthought, if you like. So not medication as the first thing, but some form of social activity. And actually, I've asked them to call it a live well service. And I think this is where we get to when we kind of think about healthy longevity, a live well service. That's to me what we should be looking to build, not just in every single community of Greater Manchester, but in every single community across the country, indeed across the world. And recognizing the support that people need first is social support, not medical or clinical or healthcare support. So I'm talking about simple connection between people to help them boost levels of physical activity and perhaps, you know, meet new people along the way. So a concept that I've been pushing here, and I think it is now a thing, you know, we have the park run on a Saturday morning for, let's say, the more middle-aged demographic. Well, why don't we have a park walk on the same principle for older people on a Tuesday afternoon or whenever? The idea that people can come together and meet new people, but also then get the benefits of taking part in physical activity together. This is the kind of philosophy that I want to embed in a live well service for Greater Manchester. You could point to other things as well. I do think that digital inclusion needs to be a very big part of this debate when it comes to healthy longevity, because as the world has taken an ever greater stride towards the online space, certainly as it did in COVID and coming out of COVID, there is a risk that we create new forms of exclusion amongst older people. I was on my weekly phone in on BBC Manchester yesterday, and somebody rang in saying that the hospital had moved all of its appointments to web-based appointments, and she couldn't access an appointment because she just doesn't do that. It's not what she does. And I kind of feel that there is a risk here if we're not careful of new divides, new forms of exclusion opening up if we're not careful. So, I mean, part of our vision around ageing in Greater Manchester is we have set a target for all over 75s online, and providing the support and the skills that people will need, the digital literacy to stay online. For me, that is part of a live well service, keeping people connected, not just digitally, but with each other, in the conversation, in the room, aware of what's happening in their community. I think that's tremendously important. And that has also been an issue relegated to the fringes of public debate that I think needs to become much more prominent. We should have a very serious policy focus on digital inclusion of all older people if they are able to access all opportunity, all support in their communities. I mean, there's plenty of other things I could touch on, and I don't want to to speak for too long, because I think you can probably pick up where I'm going with this. I think if you carry on trying to support a vision of aging with a 20th century medical model, it is quickly becoming unaffordable, but also it doesn't give people what I think they're looking for. I feel many people are left going to their GP when they're not thriving socially, because it's the only really option that they've got, and they often then get solutions that they don't need, prescriptions for medicines that they'll never take. And that's why I look around Greater Manchester and I see the very best of what I see going on is about turning that completely on its head and starting with social support. So I was visiting one of our primary care networks in Hyde, in Tameside, just a couple of weeks ago, Healthy Hyde. I would encourage people to look it up. This is a primary care practice, but more than that, a network of local primary care providers, basically starting with social rather than medical, and really bringing into life what a live well service might look like. And I do think in that context, it's important to see the community and voluntary sector as an equal partner to the statutory bodies like the National Health Service or the Council. I think if you're to promote a system of everyday support to get the most out of life and to help people age well, then I do think you have to start with the community and voluntary sector as equal partners, long-term partners, trusted partners in the delivery of that more informal support, if you're to get the most out of the investment that goes in. But Healthy Hyde, look it up. You know, it's a fantastic kind of example of how you take the social model and apply it really rigorously from the off in primary care. So that's the view from Greater Manchester. I hope you'll pick up from some of that we do have some claim to being one of the World Health Organization's age-friendly city regions. Certainly, I'm supported by a great team here. You know, even in difficult times, people are doing work to rethink mentalities, challenge old assumptions. You know, not coming through the frailty index mindset of kind of thinking about older people in that way. You know, the team here very much had a campaign during the pandemic that it was about challenging vulnerability and some of the kind of notions around that kind of potentially could have got more entrenched during the pandemic. They had a valuable, not vulnerable campaign, and I think in many ways that says it all. And I think through that you'll pick up everything that I'm talking about and what we're trying to pioneer here. We've got lots of other examples of projects that might be of interest to people. And I think probably at this point, I'll draw my remarks to a close, George. But the final thing I would say is, if you're going to have a vision for healthy longevity, I do think it has to be preventative, person-centered, place-based, where all of the agencies that are there to support older people, be they in the benefits system or in the healthcare system or the council system, or then in the community in terms of the voluntary organizations. Basically, what you have to do, in my view, is network those organizations to work as one system of support that is true to the principles of preventative and person-centered and place-based. And then you also have to, I would say, ask it to adopt a new mentality, which is about contribution rather than dependence, and activity rather than rest and inactivity, as I said before. And if you kind of operate in that way, I think you don't just improve people's physical health. I think what you do is more important than anything is you lift people's mental health. You give people a sense of purpose. You let people be the people they always wanted to be. For those with dementia, you connect them to their past passions, which is the best therapy that you can ever give somebody who has dementia, and from there, you know, you give people that mental lift, and from that lift to people's mental health comes so many other societal benefits. So that's us. We're work in progress. We haven't cracked it by any means, but I think the incubator that is Greater Manchester in terms of developing new thinking about public policy in the UK is beginning to throw out some quite interesting findings and results.
Andy, thank you very much.
You're welcome.
I think if I take one thing away, we've been talking a lot about the roadmap and all the rest of it, which really talks to the head. And I think what we've heard from you in the last 15 minutes is really how it takes talking from the heart to actually make all the talking from the head work. So I know you've got a really busy schedule, but I'm going to ask everyone here just to join me and thank you very much for taking time out to talk to us. Andy, thank you.